back, Doctor. We'll be starting soon.
Okay, no problem.
All right, we'll be starting right now. So, good evening, everyone. Thank you all so much for joining us here tonight for Dive into Medicareers. My name is Adrian, and I'm delighted to be your host for tonight. So, I hope that you enjoyed tonight's session and take away something useful from it. Today, we'll be focusing on psychiatry, and joining us here will be Dr. Harinder, who is a clinical psychiatrist at the Vibes Healthcare. She'll be sharing with us here today information about the field of psychiatry, her experiences, and how she got to be where she is today. So, just a rough idea of what we'll be doing tonight. We'll start off the event tonight with a talk by Dr. Harinder, followed by a Q&A session at the end for everyone to clarify any doubts you may have, any questions you have for Dr. Harinder. So feel free to type your questions in the Slido link provided in the chat box. And as we proceed with the event, kindly refrain from typing questions in the Zoom chat box. Before we begin, make sure to read the housekeeping rules posted in the chat box. Please abide by the rules, or else we will not hesitate to remove you from the meeting. And without further ado, Dr. Harinder, the stage is yours.
Hello, hi everyone. Let me share my screen here. Okay, so everyone, you all can see my screen. Okay, so yeah, okay, so I'm going to start now. Yeah, I'm Dr. Harinder, but before I introduce myself, so today my topic that I'm going to be talking about will be understanding the pathway towards psychiatry. Okay, so later on in my slide, I'll be explaining what is actually psychiatric is, and the pathway, how to become a psychiatric, and then a little bit about syllabus that usually are being taught in a master's degree, right? So I hope everybody have taken their dinner. And this is my center. I'm working in Vibes Healthcare. So we have a team of psychologists, counselors, and psychiatrists. So what we do there will be, we'll do a psychological counseling, we'll do therapy addiction, okay? So this is my center located in Bangsa. So before I move on to this slide, okay, I would like to share a little bit about my experience when I was a houseman in Penang Hospital, GH. 6 posting will be our psychiatric posting. Usually is either you'll get a psychiatric posting or you will get either emergency department posting. So most of my friends, they will be thinking that I hope that I got into psychiatric, because they think that once you enter psychiatric department, you don't do anything, it's no hands-on work, right? Not like emergency department where you need to intubate the patient, you need to a lot of things, you know, you have to do to the patient. Here, psychiatric, all you do is that you just sit down and listen to them. Yes, definitely from our perspective, when we are in housemanship, we think that during that time, psychiatric is very, very easy. But even I, myself, I did not get into psychiatric. Okay, but I had some interest in psychiatric as well when I was studying for 5 years. So when I did my MO-ship in psychiatric in the same hospital, then I realized that psychiatry is not as easy we think. Like we think it's easy, but it's actually not, okay? Because a lot of time is gone into doing history taking, you know. One patient itself, it will take at least 2 to 3 hours to, you know, to clock them, right? And a lot of communication skills. You need to make sure that you are patiently listening to them. There are certain people, certain psychiatric illness like schizophrenia, sometimes it can annoy you, you know. So psychiatric, like we think, is not that easy, okay? But there are few interesting things that is this department have that actually caught my attention, and I persuade into this thing, is that I love talking to them. I love listening to their stories. I love, you know, listening to their whatever happening to them. It's quite fun in that way. So moving on to what is psychiatric. So here I will be explaining what is psychiatric is, so that you have a rough idea what actually psychiatric does, right? So psychiatric is actually, it's a medical specialty that what do you call that, cares for people who suffer from a psychological, emotional, and behavioral disorder that are usually multifactorial in origin. Okay, that means that all these problems can be caused by something else. Okay, there's a lot of causes that cause mental illnesses. Okay, like anxiety, depression, a lot. You have a lot of other kind of, maybe you have a psychological problem, emotional problem, and behavioral problem that cause anxiety. Okay, so what actually psychiatrists is that they are usually, they are clinician that usually deal with, you know, studies prevention, diagnosis, and treatment for mental illnesses. Okay, they are actually specialized in these 3 things. Okay, so we first need to diagnose them, subsequently treat them, and then we have to think how to prevent this kind of mental illnesses. Because when we are in this department, a lot of patients like schizophrenia, for example, okay, it's a long term. The medication is for a long term. Okay, there is, if you stop the medication, the patient will get relapsed and so on. Okay, so that's why psychiatry is it's a very complicated in that sense, because we have to deal with the patient till they die. Okay, anxiety, depression. Okay, yes, we can give them medication for 6 to 9 months. subsequently they might get relapsed. Okay, if they have a family problem, any kind of stresses that they got into, they have to come back again for treatment. So what we usually think, what we usually do is that we will hope that they do not relapse by they taking the patients, take medication, okay, every time. Okay, so here a very unique feature that actually the reason why I love psychiatry is that because of the management, okay, does not only deal with the patients, okay, they also deal with their family members. Okay, for example, schizophrenia. Okay, I hope everyone knows what is schizophrenia. Schizophrenia is a condition where patient will be having hallucination, delusion, and so on. Okay, so this kind of this kind of patients, they are unable to communicate, okay, with the um, with us, with the doctors. So what we can do, usually we get the information, we get history taking from the family members. Okay, so this is like the whole thing. See, when you enter in a department like what do you call that, emergency department or medical department, okay, one patient, it will take, I think, 1 hour, and then you are done. You don't really need to ask the family members. But here in psychiatry is the whole thing. You will have to speak to the family member, the parents, siblings, and so on. Okay, and also I can give an example: personality disorder. Okay, so certain patients that having borderline personality disorder. Okay, so mostly BPD happens to female. Okay, they will like to try to cut themselves and so on. So who else we can ask other than the patients? Okay, we have to ask their family members, parents. Okay, whether what are they doing at home? Are they really doing it? Because some certain patients, they tend to mask this thing, or they tend to lie to the practitioner, okay, that they're doing all this to get a letter of whatever. So we have to also make sure that the information that we got from the patient is correct. And then if you really want to be a psychiatric in future, okay, the one thing that is very, very important is the skills. Okay, communication skills are very important, because when, like I have mentioned, per patient, one patient itself, it can take up to 2 to 3 hours. Okay, and then sometimes every week you need to, okay, in a private setting, you need to monitor the patient weekly to weekly basis. Okay, but when you are in a hospital setting, when the patient is admitted, you have to see the progress every day. So during my experience, when I was in a medical officer in a hospital, when I worked in the ward, every day we will have at least 5 to 6 hours history taking and reviewing the same patient daily. We will only see 3 to 4 patients, but it will take at least 6 hours for us to see whether there's any progress, did they even take their medication, and so on. So without this kind of communication skills, we will not be able to achieve the correct diagnosis, and we will not be able to give a proper treatment to the patient. That's why if you really love, if you really want to pursue into into this department, the psychiatric career, you need to know that your skills of communication, your patience to listen must be there. Okay, if you're a person that you're not a person that can sit down and listen to the patient and try to connect the dots, then psychiatry is not, I don't think so, it's a path for you. But those who thinks that they can do this, I think it is perfect. Okay, so why here today, the reason why I'm giving this talk is to to make y'all feel, to have a broader mind that why you should choose psychiatric as a career. Okay, so when you the good thing, when you choose psychiatric as a career, is that you're able to analyze. Okay, you need to analyze and bring together all kind of problems, okay, without analyzing, okay, without a proper communication skills, you unable to analyze, okay. So you need a communication skills so you can analyze and you can bring together all the problems and come up with a diagnosis. Okay, sometimes the patients they have a very limited insight into their own problems. Like I've mentioned that schizophrenia, they might not know that they are having what do you call that, delusion, hallucination. Yes, they do tell you that they're having all this, okay, especially delusion they will be denying, okay. From my experience, I have a patient currently that I'm seeing that he is very he's having persecutory delusion. That means he's afraid of people. When he goes out to the road, out of his house, he's thinking people is harming him and so on. So he is so scared, and he's remaining, he just want to stay in the house. But for him, it's not a problem. But what his mother have noticed is that why is he behaving like that? There's no one actually harming him, but for him, he feels scared. So this kind of patient, the parents will bring them in and say, they're having this kind of problem, but they are so their belief is so strong, they think that people are harming them, okay. Even today, I have a patient who thinks that when he goes to work, he thinks that there are people who are hacking into their phone. This is all kind of delusion. But the fact that we know that there is no way that your phone can be hacked and can be put some kind of a device in it, okay. So you need to, this is few things you need to know about psychiatric, that you will not have a definite kind of testing, okay. For example, like diabetic, when you do a blood glucose level, you will know that this person already have diabetic. Or even if you take a blood pressure, this person is having hypertension. But for psychiatric, there's no a proper definite test or investigation need to be, when you need to do to get the diagnosis, okay. All we need to do is we need to listen to their stories, and we need to analyze which where they do they fall in, okay. There's some certain types like schizophrenia, they cannot fulfill all the criteria. So we have to think, okay, this is one part that maybe they have only delusional, so we cannot label them as psychotic disorder, we cannot label them and so on, okay. But for psychiatry, we actually do CT brain, and then we will also take a blood test as well, because we want to exclude the medical part of it, okay. So here I'll be explaining the pathway to become a psychiatric. Okay, so now I think in Taylor's right now, you all are doing A levels. Okay, so this is the pre-medical course that you can take after SPM, A level, STPM, Foundation in Science. Okay, after that, you will enroll in MBBS degree, okay, which is 5 years actually, 5 years. But if you are doing it in overseas, it might take longer, 5 to 6 years. Okay, and then you will undergo the 2 years of housemanship. Okay, housemanships not necessary, like I have mentioned, that you will get psychiatric posting, okay, because psychiatric posting is not compulsory. It's your luck if you get it. Like at the end of the after the 5th posting, they will give you a choice if your hospital allow, or else they will just randomly choose, okay. So right now, if I'm not mistaken, it's already 1 year of compulsory already. Then after that, okay, after you finish your compulsory internship, okay, you can take these 2 pathway, this MOHE pathway, okay, or MOH pathway. So here I'll be explaining the 2 pathways. The first one will be the Ministry of Higher Education Master in Psychiatry. Okay, this is a 4-year program in which the trainees are registered to specific university, and undergo general and subspecialty posting in the university and MOH, Ministry of Health Accredited hospitals. Okay, and then the second pathway will be the parallel. Okay, this is the one that usually you need to pay. Okay, this one also like 4 years program, but the different thing is that the assessment are different. Okay, it's there are few pathways. The parallel pathway, right? You can either take MEDEX, Part A or Part B MRC Psych. Okay, this is the UK MRC Psych is the UK one. It's quite difficult because my Part A I took quite long time to do it because it's super, I would say very, very difficult exam. Okay. And then subsequently, you will go into the specialist training in psychiatry. Okay. So there are 3 phases of training. The first one will be 12 months training, okay, designed to ensure that the trainee acquires fundamental and foundation skills in general psychiatry and knowledge of basic science. Okay, then the phase 2 will be comprised of total 24 months, okay, of training in general psychiatric as well as subspecialty rotation. Okay, there's quite a number of sub in psychiatric as well. Okay, and then the first phase 3 will be the final 12 months of the 4-year program during which the trainee undergoes training in advanced general psychiatric, consultation liaison psychiatric, as well as leadership and management in the posting. Okay, so what is consultation liaison psychiatric is that it specializes in the interface between the general medicine and pediatrics. Okay, so you're not only you will be seeing pure psychiatric patient, but you will also go to the ward where normal patients, okay, are having dementia, okay, Alzheimer, all that, stroke, you know, so they will also have psychiatric problem. Okay, so then after that, as you can see, I will make it bigger. Okay, and then after the 12 months of combination, you will do workplace-based assessment, okay, which is called CBD, mini CX, okay, and all this PPRV. Okay, usually in Malaysia, we usually do CBD and mini CX, okay, and then you need to do the portfolio and like other master degree as well, they will also do research and clinical audit. Yeah, after that, you will be fulfill the training as a specialist. You will get your master degree, okay, and then the certificate of completion of training by MOH. Okay, how you get that is that post-training supervision, you have to do a gazettement 6 months or supervision for 12 months. Okay, subsequently, you will register with the NSR. Okay, you have to complete 1 year PTS, which is a report, PTS report, supervisor testimony, all kind of log, you know, you have to complete 1 year. You have to do in psychiatric department and so on. Then finally, you will be registered as clinical psychiatrist. Okay, then you will get your APC. So the process is quite, I think it's the same like other department as well. Okay, they got the same process. They even got the same pathway. They also got the parallel pathway and the normal pathway. Okay, they got not, I would say not psychiatric one. They might have MRC psych, even surgical, they have that. Okay, and MEDEX as well. This whole thing is the same, and then the training also the same. Okay. So a little bit about the syllabus so that each and every one of you all here will understand what kind of what actually you are going into. Okay, so what they will be teaching will be specialized area. Later I'll be explaining leadership administration. This is very important. Okay, when you are in a psychiatric department, you need to show your leadership and so on. They do teach all this. And then assessment, you need to assessment procedures and therapeutic skills. Neuroscience, very important. Psychiatric disorders, and lastly, it's the clinical audits. Okay, so the syllabus, each topic, okay, this one, basic psychiatric, it provides phenomenology and psychopathology, sociocultural, religion, and spirituality in psychiatry. So in basic psychiatry, you will learn all this. It's quite basic, like how psychiatry has evolved, okay, how people be, how the patients are thinking, how we as a normal human being are thinking and so on. Okay, so how the experience that is happening, I mean, what kind of experience, abnormal experience that is happening in the patients and all. Okay, neuroscience is also very, very important, okay, in psychiatric. So what we will be learning is neuroanatomy, neuropsychology, physiology, neurochemistry, psychopharmacology, psychoimmunology, genetics, and psychological science. Okay, we need to learn the neurology of the part of the brain and so on. Okay, this is the specialized area. This is the one that I was saying that we will also learn addiction psychiatric, geriatric, consultation liaison, community and rehabilitation psychiatric, neuropsychiatric, child and adolescent psychiatric. Okay, and forensic psychiatry. Okay, currently my interest will be in forensic psychiatry. Okay, so forensic psychiatry is the psychiatric that will work usually alongside with the lawyers and all. Okay, they will be how to say, forensic psychiatry is where if someone even did a murder or trying to kill someone, right? So what we as forensic psychiatric will do, we will go and take a history from them and try to analyze what have caused them to do kill someone. That is forensic psychiatry. Okay, and how did they kill and so on. So it's a very interesting subspecialty. If you all like this addiction or geriatric and so on, it's very interesting. Okay, otherwise basic will also be good. Okay, and then in that syllabus we will also study the common disorders and the rare ones. Okay, that's a lot. If you are interested and so on, you can buy that psychiatric book, DSM, and then every day you can just read one page by one page. Okay, if you want to know that more about psychiatry. And then we will also learn about leadership and administration in psychiatry. Okay, this one is the skills to become a leader, basically. Okay, and then yeah. So this one, assessment procedures and the therapeutic skills. In this, it provides the 3 important assessment procedures. Okay, we have to know about the suicide risk. Okay, a lot of patients like depression and so on can cause suicide and all, right? So we need to know all that. Violence risk, okay, bipolar when they are in manic phase, or kids, okay, who are really in anger phase and so on, they can cause violence. And then the mental capacity. And then we need to know the intervention in psychiatry. So lastly will be this clinical research and clinical audits. This one, every department will also have this at the end, because you need to do research. So my advice, okay, if you really want to you want to persuade this course, okay, to be a master's in psychiatry, you need to create your own path and work hard towards it. Okay, Like me, for example, when I entered housemanship, I didn't knew that I will love psychiatry. I had that thing that, okay, I don't like anything else. I think the only way for me was psychiatric. But when I became a medical officer, I have found love being there, listening to my patients. And sometimes I'm happy thinking that, at the end of the day, they are actually better. So what I have done also, I did a diploma in CBT. That means I can counsel patients as well. So because sometimes psychiatrists, all they do is that they give medications, and um, and they don't really go into deep into their problem. So because of my passion, I have went beyond that and did my diploma in counseling. Currently, I'm doing my diploma in addictions as well. Yeah. So like Abraham Lincoln said that the best way to predict the future is to create it. So it's a very good part. Okay. So thank you. It's a very short and short slides. Okay. So it's a very very short. I wouldn't want it to give a very deep thing, because this is all about psychiatrists that you need to know. Okay. Unlike Mr. Sean here, I hope that I change his mind from surgeon. He can be a psychiatric as well.
All
So
right.
Adrian and Myra, maybe you can have your passion. Maybe it's not you do not need to be a psychiatric, but you can do a short diploma on how to counsel people and so on. It's quite interesting. Everyone, whoever is listening, is that each and every patient, they have their own personality. Okay, there's a lot of personality that is available in our own self. But when you try to figure out, analyze that, this is what something new comes into them, you will feel that thing of achievement in you, that this is quite exciting and so on. Yeah. So a lot of things. I hope you all understood my slides, and if you have any questions, please do let me know.
Is that all, Doctor?
Yes,
Okay.
that's all.
All right. Okay. Thank you so much, Doctor, for the very informative presentation. I hope everyone learned a lot of new things here. Now, moving on, we can start our Q&A session. And you can drop your questions down into the Slido link provided in the chat. Hopefully, Doctor's presentation was able to spark interest in psychiatry participants.
Yeah. So
I know
those who are interested in talking and listening, so I think y'all, whoever is joining here, y'all can start talking. Who knows, I can analyze y'all.
analyze our personalities.
Yeah, analyze your personality.
Wow.
So a little bit, I since nobody is asking question, okay. So the parallel pathway, right? There's part A, part B, and part C. Yeah. So there's 3 parts in the MRC. Not MRC psych. Okay. The parallel pathway, the Royal Psychiatric. Each papers will be around 3,000 to 4,000. Okay, per day. So maybe if 3 papers will take at least 12 to 13,000. So those who are interested in the parallel pathway, this is the costing that you can save to go into that if you're not able to do the masters in the other pathway. I saw that there are few people is asking question.
Yeah. Hold on. Okay. Can you see the screen?
Okay, let me see. Okay.
All right. So first question we have: can the MBBS degree be replaced with bachelor and masters in psychology?
MBBS degree, if you're doing bachelor and master in psychology, the pathway will be different. Okay, you'll be a clinical psychologist, you'll be a counselor. After the clinical psychologist, you can also be a doctor. Yeah. So it can be replaced unless you don't want to be a psychiatric, you just want to be a clinical psychologist or counselor. Okay, something similar with psychiatric will be clinical psychologists, because clinical psychologists, they do what psychiatric does. It's just that they don't give medication, but they do learn about medications as well. Okay, and then they will go into more into counseling and then intervention. Okay, their intervention will be CBT, ACT, all kind of therapy. It's also very interesting. If I didn't if I didn't take MBBS, I would have done the bachelor and master in psychology. I think it's quite a demand. Okay, those who don't want to have that 5 years, it's quite a demand in Malaysia, because mental health is actually really growing very fast, and a lot of people are having mental issues. Okay, students, workers, all kind of those in companies, even up to 60 years old, they're having mental issues. Okay, so if you really want a faster process, you don't want to spend 5 years plus 2 years of internship, okay, in housemanship, you can do bachelor and master in psychology. I hope I answered the question.
Thank you, Doctor. Next
Yeah, and
question.
either way, it's cheaper, I guess, to be a clinical psychologist or counselor compared to medical degree. Yeah, so you can see which one will be better for you. And then could you share the most interesting case that you came across? Okay, I have a lot of interesting cases, but right now in Vibes Healthcare, I don't think so I can share some, or maybe I can share. Oh, okay. Yeah, so there's this person, she's a foreigner. Okay, so I would say that they have, I would say she was very young. Okay, 20 around 20 years old, and then the gap between her husband is quite old, 30 something, so their gap was 10 years old, and then 10 years gap. So this person, they came in to Malaysia, they worked in here, and then sudden what do you call that, situation happened where the husband cheated on her, and then she, not cheated, I would say that, okay, cheated, and then she found out, and then what happened that she went into the psychotic things, where she started thinking everybody is against her. Okay, so she will, even if she goes out, she will not trust anyone, and then she used to torture her husband, and then she will tell them that, you are hacking into my phone and you are trying to kill me, and so on. Okay, so all that happened, and then when they came to the clinic, they did not trust me, and so on. So because of the financial instability, they had to go back to their country. Okay, and I know that the husband contacted me, and currently she's stable. That is something interesting. Okay, and then I have a patient who are usually schizophrenia is very interesting. Okay, like anxiety, depression, for me, it's just, they're just having all kind of symptoms. And then what else? I think that's the interesting cases that I've seen where delusional disorders are very interesting. So next will be mental disorder is a pretty taboo topic. Oh, okay. I think 2 years ago when there was no COVID, I would say it's very taboo because nobody knew about mental disorders. Okay, right now, yes, a lot of people don't even know what counseling is, and they are very afraid to even speak up. Okay, the reason why I have experienced a lot of my patients are from the age of 13 years old to 18 years old, where actually they are having depression, they are actually suicidal. But the problem with them is that when they try telling to their parents that hey, I have a mental disorder, what the parents will do, they'll brush off and say that you're just being silly and so on. Okay, that's why at this current phase of life, a lot of people who are working life, they're having this kind of problem because the parents are not acknowledging that actually mental disorders are actually very, very important. Okay, maybe I will not blame the parents because they came from a different era. Okay, now we are different era where we are speaking about mental problems and so on. So during at the age of 40, 50, even my parents, I would say, they have the same thinking. When I told them that I want to pursue myself in a psychiatric, then they told me that if you become a psychiatrist, you will might be like one of them. So so I have also went through a lot of difficulties. Okay, because being into this career is not easy. So when you receive a lot of information from people, sometimes it can make you very, very tired and so on, right? So it is definitely still a taboo because some people might not understand. Okay, some people are afraid when they go into companies, they go into depression. Okay, they are very afraid to tell to their bosses. Okay, scared, they will be so scared because their job will be, they will might fire them from the job and so on. Which actually does happen. Some of my patients, when they tell the bosses that I'm having mental problem, I'm having depression, so they don't really take into account that you might have a problem, and we should help you, but it doesn't happen in Malaysia. Okay, if like in US, if you in overseas, every person will have a counselor with them. I don't think so everyone actually, they do have someone who they can talk to. Okay, so when psychiatrists, yes, you, instead of seeking psychiatrists, there is alternative clinical psychologists. If you want to talk to someone, if you feel like you have some stress and so on, you can, instead of going to psychiatrists, you can go to a clinical psychologist. It's not a bad thing. It's just talking to someone, figuring out how your problems can be solved. Okay, and then when do we need, if we should seek help? Okay, when you know that um, when you are really feeling suicidal, that is a must go. You have to go to a psychiatric already. And then you feel that your family member is saying something is wrong with you, like schizophrenia. If someone is telling you that, why are you being delusional? Okay, and you started seeing some or hearing noises from people. Okay, that is where you need to start seeking from psychiatrists. But a lot of my psychotic disorder patients, they will come in a later on stage where it becomes so bad. Okay. Okay, next. How psychiatrists related to neurologists? Okay, psychiatry, we have to learn about neuron because there are, when patient get stroke or some kind of brain, something to do with the brain, okay, I would say, or brain tumor or something, okay. So we need to learn, there is disorders related to neuropsychiatrist, okay, like stroke, you will be demented, Alzheimer, all that is under neuro part. Okay, so we have to do assessment. Why are you having dementia? Why are you having Alzheimer? Okay, that is more to neurologists. Okay, for example, I have a patient went into accident where it was quite a bad accident where it caused his brain was bad. I would say he was 23 years old, but then his functionality, he forgot how to even drink water, how to even eat. Okay, so neurologists will ask psychiatrists to come and evaluate that part. Why all this that thing is happening. So we have neuropsychiatrics help as well. Okay. So what is the main difference? I think I've explained that the difference between clinical psychologists and psychiatrists is that psychiatrists, they will give medication. They will just I wouldn't say counsel. They will take history, okay, what is relevant to their diagnosis, and they will start on medication or no medication. Clinical psychologists, they will counsel you. That means they will take history and then they will try which kind of therapy that is needed. Okay, so from my experience, for me, I love to refer to clinical psychologists because they come together. Psychiatry can give medication, but it will not be for long. Like for example, depression, anxiety. If you really want to get cured from this problem, you need to know how to change the way you think. You need to know how you're going to de-stress yourself. So that's when clinical psychologist comes in, okay? Because they will teach you the intervention part, okay? How you're going to think positively, how like cognitive behavior therapy. So how you're going to change the way you think and so on. Which psychiatrist do you look up to and why? So I have the reason why I really love forensic psychiatrist was when I was in Penang Hospital, I had a specialist. His name is Dr. Emmanuel. He was a forensic psychiatrist, and I really love the way he treats the patient, and when he told me that there's not many forensic psychiatric in in Malaysia because not much cases of people murdering. You know, like in US, if you see documentaries in Netflix, right? All these weird kind of I would say serial killer and so on. So forensic psychiatric plays a very important part in that kind of cases, you know. So for me, I love I love working in together with the lawyers and the CBI and so on. I mean, that is later on in life. Yeah, so I think I've already answered why did you choose? Because I love talking to patients, love to analyze, even though it's a little bit tiring, but I just want to see, sometimes you just want to know what is actually happening into their brain, you know. So that's me. Like I said just now, the pathway will take at least 4 years, okay, starting from college. Starting from my university will be 9 years. It is better to, I think psychiatry in Malaysia or overseas is, I think is the same. It's just that maybe the cases will be different, okay? Because when I did my I did my MBBS in Indonesia, right? So psychiatric cases in Indonesia is way different from in Malaysia. Okay, so what I usually get in Indonesia is that I will get more to schizophrenia, and then also bipolar. Usually my foreigner that comes to my university will be from US and so on. They are mostly diagnosed as bipolar. And then, yeah, so the cases are different. So it's the same, you want to pursue psychiatry in Malaysia or overseas, your exposure to psychiatry is the same. It's just that maybe the way they teach and so on. So my parallel pathway that I'm doing, I've done is, what do you call that? The psychiatry. Okay, so that will be different because the assessment all is different compared to the one they are doing it in Indonesia. When consulting a patient, how do we not get too emotionally invested? I don't know how to answer this question. Okay. I honestly, I've been in this for quite some time. There are certain times when I counsel patients, when I'm with patients, sometimes I'm emotionally affected. Okay, not all the time. Sometimes I am emotionally affected. You know, I bring back all that kind of thoughts in, you know, to work, to back to home, and think that, you know, I feel pity them, that why are they going through, how am I going to help them, and so on. But at the end of the day, you as a doctor, all you need to do is that you must not get too involved. Okay, all you need to do is that your aim is to cure them. Okay, not to really be emotionally connected to them. Okay, that's what when in clinical psychologists, that master or bachelor in psychology, they'll teach you want to do. They will teach you how to be not emotionally connected, how you want to maintain a practitioner and a patient's rapport, you know, all that. So if you're, yeah, usually in doctors, in psychiatric, they don't really teach that much, but in clinical psychology or counselor, they do teach. So the reason why, how I know is because I did a diploma in CBT. So I have that some kind of, I've learned from that basically, how to not get emotionally invested. Will the psychiatric dangerous when the patient is aggressive? I have encountered aggressive patients. There are times when I did my on-calls at night and I was all alone. And then it was quite scary because I'm afraid of ghosts, you know, and and then when the emergency department, they will call you and say, hey, you know, you have one case currently in emergency, can you come and see? And then they will just give you a room, and then that patient, the psychotic patients, usually at night, the most psychotic patient will come. Okay, some females, I had Singaporean patient that is lying, tried to kill herself in Penang Bridge and so on. So all this, once I had a case that this guy, he was really disheveled, like he never bathed for years. Okay, it was so smelly. His what shirt, his basically his whole hygiene was so terrible, you know. And then they give you a room where you have to be inside in that room, and then he will be shouting, and then he'll be scratching the thing. You are not sure whether he got some kind of ghost attack or he really got a psychiatric attack. That's my first encounter when I was medical officer. So in that kind of cases, you need to bring someone with you, because you are not sure whether they can be aggressive. Sometimes they are just, you don't know. Okay, so that's why as a psychiatric, we will learn how to, if the patient is over this side, you make sure that our position is near to the door. So if anything happens, you can actually run out. So they will basically teach you. Over time, you will get used to it. Okay, I had occasions when I was in Indonesia that they are so aggressive, they will come and touch you, and spit on you. So all that kind of interesting things that happened to me. So it's quite funny, but that time I was actually quite afraid as well. Okay. So the skills that you need to possess as to be a psychologist will be, like I said, communication skill is very, very important. If you don't have a proper communication skill, you will not be able to build a rapport with the patient. Okay, but the patient will not able to understand what is going on. Okay, there are certain occasions in my center currently, I have patients that complaining, clients are basically, they're complaining sometimes the psychologist, the counselor are not really talking much, and so on. Sometimes they are talking too much. So all this, is actually, we are taught to be that, like first session, you need to listen. Okay, but sometimes the patient, ask, they expect us to talk. Okay, so all that, a lot of things need to be, you need to start analyzing when the patient is quiet. There are certain patients on the first session, they will not be able to talk much, they don't know how to express themselves. So you need that kind of skills to, to dig up one by one a little bit. Maybe you can start from their family problem, start from what kind of stressor and so on. Okay, so this one all they will teach in your master's. Which field of psychiatric do you think is most interesting? Okay, so there's quite a lot of psychiatric field. I think everything is interesting. For me, when I went into psychiatric, I have tried neuropsychiatric, geriatric psychiatric, and then even child psychiatric as well. So it doesn't really interest me because from beginning itself, I love investigating and love knowing what is into some mind and so on, basically. So for me, I love forensic. So if you like something to do with neurologies, you're good. Or you like something to do with child, they are more to ADHD, and all kind of autism. Okay, so that is, it's actually up to you. I think each and everyone got their own preference. You just need to know which one. So when you become a medical officer, right, they will actually give you an opportunity where you can go into each and every sub psychiatric and see which actually is interesting for you. Okay, I will not recommend to pursue it because I might not know what is you might have a communication skills to be a psychiatric, but you might not know what are you good in, right? Okay, like child psychiatric, I'm a person, I can't deal with child. They are child that they will be very naughty. ADHD is they're hyperactive. It's very difficult to talk to them and so on. So it is actually up to the each and every individual. Okay, any other questions? I hope that I'm able to answer most of it.
Right. I think that wraps up the Q&A. Thank you so much, Doctor, for answering all the questions. And that would be it for the event. So currently on the screen is our social media for the TLPMC. And if you guys are interested in joining, you can scan the QR code. Uh, sorry, it's a bit noisy here. The feedback form will be sent in the chat box now, and don't forget to fill that out, as certificates will be they will only be given to those that fill in the form. By filling up the feedback form, you can have an input into TLPMC's future events. You can let us know how we can improve. We hope that this event helped you gain more insight about the field of medicine and hopefully build some confidence, some motivation, spark some interest to people about psychiatry. Furthermore, as displayed on your screens right now, social media. Before I dismiss everyone for tonight, I just want to take a minute and bring your attention to other events that we have lined up. Our final event will be on the 23rd, which is tomorrow. It will be a pharmacy talk by Dr. Renuka Selapens and a student speaker. She is Angeline Wan. She's a student from the School of Pharmacy. And that's all. As always, thank you for joining here on a weeknight, and we hope that you enjoy yourself and learn a lot of new things from today's session.
Thank you, everyone. So have a great night. And yeah, I'll see y'all next time again.